Hi, this is Jessica Boos, and I'm going to be doing a critique of the role play that I just did with Mandy on being the therapist and using narrative therapy with my client. So, one thing that jumped out at me right away, even though we practiced this multiple times, I think one thing I had a little bit of a tough time was effectively deconstructing her history. I think I was very strong in helping her externalize her problem with anorexia, but as far as the reason I said that I think I was weak in deconstruction was because I really didn't investigate if she had any underlying issues such as depression, or I really didn't explore too much with her. Why does she have the assumptions and the beliefs that she has to be thin in order to be a gymnast? I mean, in reality, not every gymnast is thin. Gymnasts are actually very muscular, and it's important for them to eat. So being thin isn't necessarily a hallmark of gymnastics. So I could have done a better job by deconstructing her history, again, figuring out why does she have this idea in her head. That way she would have a better idea as to why does she feel like she has to starve herself in order to be a good gymnast. So that was one thing I definitely think I could have done a little bit better. I hope it's okay for this critique. A few things that I felt that I did pretty well with was helping her to try to think about what would her life be like without Rex, which is the term that she coined, that we coined together for her anorexia, and that was used to help her to externalize the problem. So I think I did a good job in helping her to see herself as separate from anorexia, seeing that she can function very well without it and possibly even be much healthier without it. Again, in future sessions with her, maybe then I would go back a little bit more into the deconstruction, figuring out her history, her beliefs, what her home life is like, what the morale is like on her team a little bit, and try and help her to really reauthor what her story should look like from here. And that was the whole point of asking her, what would your life look like without Rex? That was the reconstruction. What would your story look like, healthy, without Rex looming, without Rex tearing you down? Now, and she also mentioned that she has a love-hate relationship with Rex, and I could have asked her, what is it about the love part that makes it love when you're in a cycle of hate, meaning, when she has been starving herself for long periods of time. Well, when she goes back to eating again, what has empowered her to do so? So that was another thing that I could have discussed with her. Some of the limitations that I think, this is just personal, that I see for using narrative therapy with the client is that, in a way, it leaves out the whole systems perspective. It doesn't really pull or touch on what are your support systems. It's not really focused on, where have you been and why are you like this. It's not really as rigid or as structured as some of the other therapies and theories and approaches. And that was actually something that Walsh said in the book about this therapy. That was one of the critiques that is just even out there in social work, is that narrative theory doesn't really pay that much attention to the whole systems perspective of a client's life. In the specific case with Mandy, there were some limitations to using narrative therapy. I mean, I feel like it was very effective, and even in the research and the literature, narrative therapy is used a lot for young adolescents that have eating disorders, just because it helps them to recognize the problem and to try and picture what life could be like without it. I love externalization. I think it's great. I think it's important to use in almost any therapeutic setting with clients. One last critique, though. If things were a little bit different with Mandy, and now she reported that she was overweight and she was anorexic. If I was, say, seeing her in a hospital as a clinician and I was called in because she was anorexic and had a very low BMI, very low body mass index, and her health was in serious jeopardy, narrative therapy wouldn't be a good approach to use, because it really doesn't address the needs of the urgent needs that a client may be experiencing. It's not a great baseline approach for when a client is in some type of crisis, because it's a more existential approach, and it doesn't really deal so much with, right there in the crux of it all, in the crisis, and helping bring someone to immediate safety, or bringing them back even to physical health or even their mental health. So again, that would be another critique of using narrative therapy. So in conclusion, I hope this has been an informational presentation. I hope that from the introduction of the concepts of narrative theory to the role play, even to the spinal critique, that it has been instructional and educational. And thank you so much for watching.